Thanks for watching Afternoon Live. He always has the latest COVID update, and today also has tips on how to be careful in this excessive heat. We welcome back cardiologist and medical researcher, Dr. Ernst von Schwarz is with us today. Dr. Ernst, great to have you back on.
Thanks for having me, Kara.
Touching on a little bit of everything today. Let's first start out with the COVID update, what we've been hearing, because now we're looking at the adolescents, right, getting their vaccination. And you hear about this myocarditis, which is kind of worrying parents.
Yeah, so far there's approximately 1,220-something cases reported to the FDA about young people, adolescents who develop symptoms of what we call a myocarditis, which is an inflammation of the heart muscle. Usually that's actually caused by a virus infection. COVID, among other viruses, can cause it. But also, obviously, there's an association between getting the COVID vaccine and those rare cases of myocarditis. So in general, those patients feel fatigue. They might feel some chest pains or some irregularities, arrhythmia. And in the vast majority of cases, that's relatively harmless. It just needs to be watched and monitored and doesn't, in most cases, not require any specific treatment. In rare cases, however, it requires hospitalization and monitoring on a heart monitor, sometimes even more heavy medication like intravenous immunoglobulins, among others, but that's very, very rare. So the vast majority heals out completely.
Is there a way to know if your child is at risk?
We wish.
Okay.
No, unfortunately, no. There's no way to predict this as far as we know nowadays. But if any adolescent, any young person, or older person, of course, too, but it's more prominent in the younger ones, have symptoms of a sudden onset of chest pain, often like stabbing pain in the chest, if they can't breathe, if they might have fever or no fever with it, and extreme fatigue days after the vaccine, I mean, that would be a warning symptom, and that should require to see a doctor, ideally a cardiologist.
So when considering as a parent the risk and the benefits of the vaccinations, what's your advice? As far as
well, the total is in the 0.003% range. That means out of the millions of people who got the vaccines worldwide, it's a tiny proportion of people who have been diagnosed with myocarditis. So at this point, the benefits clearly outweigh the risk, especially, as we talked in the break briefly, Kara, with the upcoming higher incidence of Delta variant, newly diagnosed COVID cases all over the U.S., in particular in areas with low vaccination rates. Get vaccinated. It's definitely better getting the vaccine than getting COVID.
Perfect.